allowing me here on this podium, a prestigious podium. As has been introduced, I am a neurointerventionist. So I am a doctor. Neurointervention is a doctor. And when you say neuro, that means it is related to brain. Okay? Brain is an organ which is a pulpy organ inside some hard box up there, below, above your eyes, above all your senses, which has been relegated down to the heart. Whenever you compare heart and brain, you try to portray heart as, yes, this is a good guy, the brain is a bad guy. Whatever the brain thought is not good for you thing. But let me tell you, this is where all it belongs. This is just a, no offense to the cardiologist, but this is just a bundle of muscles pumping the blood, and all of you are because of this. It is electrical circuit, it is neurotransmitters, chemical things going on, which makes you what you are, what you think, what you act, what you do. So the importance of brain health is paramount for your existence. Talking about this brain health, yeah, always there is a dogma in society. Whatever I tell you, this always wins. After I come out, people will still say, Dil se lecture diya. So that is the word. Dil always scores over the heart scores over the brain. Coming forward from that, I would like to go into a part of a brain health which is a vascular catastrophe known as a stroke. Stroke is a catastrophic event which happens with suddenness, and it carries a big magnitude of burden on the society. And you have to understand what is a stroke. Most of the people, when we talk about stroke, they again relate it to heart. So again we are relegated, but the stroke happens here. It is the sudden cut off the blood supply inside the brain which causes these strokes. So stroke, most of us have experience in our community, in our family, the events of stroke. There are two sort of events. Either you have experienced a stroke in evolution, which many of us miss because of lack of awareness, and then aftermath of a stroke. The stroke patient being relegated as a furniture in the corner of one side of the home, and being taken care, just waiting for the end to come. So that is the burden of stroke on the society. You have to understand, the WHO figure says everyone who is more than 25 years of age, 1 in 5 will suffer a stroke. The amount of burden, it is the second most leading cause for disability in the world. Disability which carries a financial burden, disability which carries an emotional burden. I say the emotional burden because whenever we see these stroke patients in the hospital, the family initially is very enthused, do whatever, we are there to take care of him, and so suddenly over a period of time this enthusiasm fades away, and the patient has been pushed into a corner and almost being forgotten that there is an existent man or a person who is living there. So now, as we know, the stroke in evolution is there. Have we acted at the time of evolution, we may have reversed that thing. We may have prevented that stroke from happening, providing the functionality back to that individual. So whenever we talk about the stroke, any disease, it has got two components we want to prevent. That's a primary prevention. We don't want it to happen at the first event. And the second is the secondary prevention. If it has happened, it should not have happened again, and what has happened should be reversed. So these are the two components of a treatment of a disease which happens. I am going to share a very relatable events with you. In Gurgaon, we are practicing this area, two sort of subset of population. You may be able to correlate with them. Young girl, 25-year-old, working in an office, night time, suddenly drops down. Brought by the colleagues to our emergency department. When we evaluate, we say, stroke. They say, no, it can't. She is 25. Stroke can't hit a 25-year-old. We say, it is a stroke. We need to act it fast. We need consents. They say the family is there somewhere else. We call them. We try to convince them. Your ward, your daughter or your son has suffered a stroke. No, doc, he is 25-year-old, or he or she is a 25-year-old guy. How can? But that's a stroke because of the change in our lifestyles, the changes which are happening. We are seeing more and more of young strokes happening. The other extreme of the scenario, 90-year-old guy, because we have got more of a life expectancy now, coming in an emergency, relatively healthy guy, doing all his work well, suddenly develops a stroke, brought by his son who is 70-year-old, no support system, because all of them have left for the greener pastures. The striking comment comes from the elderly son who's looking after the more elderly father, the parent maybe, and the comment is, Doctor Saab, if you are able to save him in a working condition, save him, otherwise let him go. Because I can't afford at this age to take care of a guy, 90-year-old bedridden guy. So these are the two extremes what we see in our society, 90 and a 25, both suffering strokes. And we have seen these patients, when they have been acted timely upon, a comprehensive treatment has been given, they get back to the functionality dramatically. So how the treatment has changed? It has changed in past a decade. A revolution has happened. A paradigm shift has happened in these treatment. The speciality of neurointervention, what I am representing, has brought this change. In fact, the journey of neurointervention is again almost like a comeback phenomena. Similarly, the stroke treatment is like a comeback phenomena. The neurointervention is a speciality which was lurking in the outside of the realm, treated as maybe this speciality may survive or may not survive, is not that effective, and suddenly things started working well. And we got a revolution. 2013, I still remember, we were practicing these stroke treatments, and some guidelines came in, the paper, medical papers, you know, they came in and they said, what you are doing is not good enough, you should stop doing this. 5 papers came in, from a reputed journal, medical journals. They said, stop it, what you are doing is just a waste of time. And it was a heartbreak for us. I very vividly remember, I was sitting with my neurologist in a coffee shop, we were sipping the coffee, we were discussing about this paper, and they said, no, we are seeing changes happening, we are able to make changes in the life of the people, what this paper is talking about. But at that time, worldwide, it was taken as all the reimbursements, all the insurance from these treatment therapies were removed. And just a couple of years after that, 2015, things started changing the other way. So in a medical jargon, there is known as the highest evidence. There are two things, highest evidence and the numbers needed to treat. How powerful is the therapy? Never ever we have seen a revolution of that thing has happening where in both these terms, in couple of years, we got an evidence of highest level, that is class 1 level of evidence A. That's again a technical jargon. That means we have got the highest evidence with numbers needed to treat of 2.5. When we say NNT, numbers needed to treat, that means how many patients you need to treat to get a good result. So 2.5 patients you treat and you get a good result. That is one of the highest for any therapies, and it changed the stroke management. And world over, the people were more interested in learning neurointervention. So we are running training programs, we are running fellowship programs where people from all specialities are coming in with different mindsets, and we are growing in that, and the speciality is growing in that. In fact, the speciality is showing a remarkable revolution in happening, it's evolution which is going on. You must have heard about a Neuralink. Neuralink, the brain-computer interface. Neuralink, where a debilitated patient, the patient who is not able to get mobilized, connects to the computer, his brain connects to the computer, and the computer starts giving command. This is functional neurointervention. We are going into the to this speciality. I just wanted to tell you this is speciality, how it is growing, how it is impacting the future, where we are moving towards entirely different thing which were never thought of. Never thought of. This is the strength of that thing. So coming back to that stroke therapy, we were talking about a secondary prevention. For a secondary prevention, most important thing is the community awareness and community participation which has to happen. That means at the community level, the people has to identify this is a stroke, because a stroke is time-bound emergency. If acted in time, you can reverse this debilitating condition, you can reverse this disability from almost to the normal. We have seen patients who were almost incapacitated on our table, and when we have done the therapy, they have come back to normal. This is that remarkable therapy, that remarkable, almost magical it is. So the community awareness I was talking about, you need to identify the stroke in evolution, because that is the time we can reverse. How to identify stroke in evolution? Always remember, anything happening suddenly which has got a negative impact. I was able to lift my hand, now I am not able to lift my hand. That is a suddenly, if I am not able to lift my hand, suddenly I was speaking, I am not able to speak. That means a vascular event is happening inside your brain. Suddenly the blood supply is cut down, the electrical wirings are going off, there is no communication which is happening, the body is not functioning. That means any suddenness with negative event, negative, that means what I was able to do, I am not able to do it now, is a negative event. We are most likelihood looking towards or steering towards a stroke in evolution. This is the time when we act and we try to revascularize or say establish the blood flows. Because the stroke happens because of the occlusion of the blood flow. The blood is not going inside that part of the brain, and that brain is slowly dying up. So if we re-establish that part, we are able to establish the blood flow back. Probably this brain is going to come back and will start functioning again, and that person is going to become like normal before. The timelines are there, but we would say that every individual have got an individual brain. There is a brain frailty which is there. Depends upon so many factors which we need to understand, but the bottom line is the time is brain. It's a time-bound emergency, the stroke, wherever it happens. It needs lot of community participation to understand. The awareness has to go in. I will just share an example. In hospital previously I was working in, almost clinical scenario, that was, we have got 2 young patients, almost same scenario. One was aware, they could access the medical facility comprehensive, and that patient got back to the normality. Similar sort of another patient, completely unaware, or they were tied out with the dogmas and their beliefs and superstition, whatever we say, and that patient is still bedbound, has been put on rehabilitation therapy. So the awareness is the most important aspect. Lastly, I would like to finish with this is the secondary prevention, but for all the disease, the primary prevention is the best. Remove all your modifiable risk factors. Whatever is there, try to control it. And the most important thing is the sleep among it. Sleep is one of the medicine which is very underrated. If you get an 8 hours of sleep, the body recovers in that part. Body tries to repair itself. So if you're having an adequate sleep in your night time, if the time which the circadian rhythm asks for it, if you have got to sleep in that time, your body tries to recover. Whatever abuses you have given to the body tries to recover that. So with this, I finish it off. Thank you.